Let me ask you something. Have you ever walked into a doctor's office feeling fine and walked out with a list of tests so long it looks like your old grocery receipts from the 80s? You nod politely, get poked and prodded, and 3 weeks later, you find yourself Googling strange medical terms at 2 a.m., wondering if your gallbladder has been plotting against you all these years. Now, here's the thing nobody talks about. Not every medical test is your friend, especially after 65. Yes, some health checkups are like that one neighbor who means well, but always manages to bring chaos to your barbecue. In today's video, we're going to dive into the 6 routine health tests that could do more harm than good for older adults. These aren't conspiracy theories. These are real concerns backed by experts in geriatric medicine. And no, we're not telling you to throw your doctor's advice out the window. We're here to help you make smarter, safer choices for your age and stage of life. So grab a cup of tea, sit back, and let's decode the surprising truth behind these common tests. Test number 1. The annual full body scan fantasy. Let's start with a crowd favorite, the full body scan. It sounds futuristic and impressive, right? Like something Iron Man would do before flying into battle. But for those of us past 65, it's not heroic, it's hazardous. These scans promise to detect hidden cancers, aneurysms, or other silent killers. What they don't tell you is that they also detect a million harmless things that send you down a medical rabbit hole. They find a shadow on your liver, cue the biopsies, CTs, and panic attacks. Most of the time, it's just a benign blip, the equivalent of a freckle on your kidney, but now you're dealing with anxiety, co-pays, and procedures that were never necessary in the first place. Worse, the radiation exposure from some scans can actually increase your cancer risk over time. How's that for ironic? Bottom line, if you feel healthy and you're not having symptoms, skip the scan. Your body is not a treasure map that needs constant digging. Number 2, the just-in-case colonoscopy. The colonoscopy. Nothing says fun weekend like chugging a gallon of salty sludge and praying you don't stray too far from a toilet. Now, colonoscopies absolutely save lives in your 50s and early 60s, but after 65 or 70, especially if you've already had normal results and have no family history of colon cancer, the risks start to outweigh the benefits. Here's why. The prep is brutal for older adults. Dehydration, dizziness, and fainting aren't rare. Sedation lingers longer in aging bodies, causing confusion or dangerous falls. Minor polyps that wouldn't have caused any harm could lead to unnecessary surgery. Imagine removing a part of your bowel for a polyp that would have just sat there peacefully for another 20 years. That's like kicking out a quiet roommate because they didn't do the dishes one night. There are non-invasive stool tests like FIT and Cologuard now that are just as effective and much gentler on your dignity. Number 3, the routine cardiac stress test. Now let's talk about the treadmill test, where they strap you up with wires and make you jog like you're auditioning for the Olympics. These tests were designed to detect heart blockages. But here's the kicker. After 65, they often give false positives. Why? Because aging hearts beat a little differently. Not worse, just differently. These false alarms then lead to angiograms, stents, even bypass surgeries, many of which aren't needed and carry real risks, especially for seniors. Let me tell you about Frank. Frank was 72, played golf twice a week, and had no chest pain. His doctor suggested a stress test just to be safe. One abnormal blip later, Frank had a catheter in his groin, a stent in his artery, and 3 months of complications. His golf swing? Never quite recovered, unless you have real symptoms like chest pain, shortness of breath, or unexplained fatigue. Skip the stress test. Don't go looking for problems that might not exist. Number 4, the PSA test, prostate panic trigger. Gentlemen, this one's for you. The PSA test, that tiny blood test that can turn your entire world upside down. Now, prostate cancer is common in older men, but it's usually slow-growing and unlikely to affect your lifespan. The PSA test, however, doesn't know the difference between a slowpoke cancer and a real threat. What happens next? A high PSA score, panic, biopsies, surgery or radiation, incontinence or impotence. And guess what? In many cases, the cancer wasn't even aggressive. It's like bulldozing your lawn because a weed popped up. Even the U.S. Preventive Services Task Force advises caution. For most men over 70, the risks of treating a PSA-detected cancer often outweigh the benefits. Want to keep tabs on your prostate? Talk to your doctor about symptoms, family history, and risk factors. But don't let a number dictate your destiny. Number 5, mammograms. After 75, worth it? Not always. Ladies, this one's for you. Mammograms are a vital tool in fighting breast cancer, but age matters here too. After 75, especially if you've had consistently normal results and no family history, the risks from false positives can outweigh the rewards. We're talking about false alarms, unnecessary biopsies, anxiety, and treatments for slow-growing tumors that would never have caused harm. Let's be real. You've earned the right not to be squashed between 2 metal plates every year. Talk with your doctor. Shared decision-making is the name of the game. Some older women still benefit from screenings. Others don't need the hassle. It's not about neglect. It's about nuance. Number 6, the annual physical exam trap. Wait, what? The annual physical? Yep, that sacred ritual of poking, prodding, and awkward coughing might not be as sacred as we thought, especially after 65. Routine annual exams often include unnecessary tests that cascade into more tests, medications, or interventions, many of which don't improve outcomes for healthy seniors. Studies have shown that annual physicals in asymptomatic adults don't lower mortality, but they do increase unneeded follow-ups, overdiagnosis, prescription overload. Now, this doesn't mean you skip the doctor entirely. It means you tailor the visits. You go in when you have symptoms, questions, or concerns, not out of habit or obligation. Your body isn't a car that needs an oil change every 12 months. It's wiser, smarter, more intuitive. Listen to it. So, there you have it. 6 routine health tests that might be better left off your calendar after 65. And before anyone panics, no, we're not saying all tests are bad. We're saying it's time to stop assuming more is always better. As we age, wise healthcare is about precision, not panic. It's about preserving your independence, not getting lost in a maze of specialists and scans. It's about understanding that sometimes the best thing you can do for your body is leave it alone. So, what do you think? Have you ever had a medical test you regretted, or one you're grateful you skipped? Share your story in the comments. Your experience might help someone else make a better choice. And if you found this video helpful, give it a like, hit subscribe, and ring that bell so you never miss another tip from Timeworn Echoes. If you'd like to support us further, you can do so by donating in the link in the description below. You deserve health care that respects your wisdom. And remember, staying informed is the first step to staying well.